Your education abroad experience will expose you to new cultures and immerse you in a global community. But you also need to be aware that there are a few risks that come along with traveling to and living in a foreign country. Depending on where you'll be, the level of medical care and the time it takes for that medical care to reach you may not be what you are used to. So it is important that you do what you can before you leave to maximize your health and safety while overseas. First stop, World Wide Web. Once you know where you're going, research the country or region you'll be traveling to ahead of time. Think of the internet as the first stop and check out the websites like the Center for Disease Control and Prevention, the CDC, or the World Health Organization. Get as much information as you can before you get on the plane. Also, try to learn enough of the local language so that if you need help, you'll be able to ask for it. Next stop, Student Health Services. Vaccines and medications can be a complex issue, but Student Health Services has a travel nurse to make it easier for you. Schedule an appointment with the travel clinic about 4 to 6 weeks before you leave. The nurse will help you learn what is needed for the area you'll be in. If you have copies of your immunization records, bring them to your appointment. While it's free to speak with the nurse, there is a charge for vaccines and prescribed medication. Medical insurance may cover some of the cost, so if you have coverage, check with your carrier to find out what's included under your plan. This can help reduce your out-of-pocket expenses. Tell the nurse about your plans while staying abroad. You may need a prescription to handle the high altitude in the mountains or deep compression if you'll be diving. She can help with special concerns like exposure to radiation, animals, or crowded areas where there are poor infection control practices. And if you have a chronic disease, like asthma or diabetes, she'll give you the specifics on how to manage your condition while abroad. Third stop, pharmacy. If you're on any prescription medication, you'll want to bring enough for the duration of your stay, plus a little extra in case you're delayed in coming home. Bring each medication in its original container and also bring a copy of the written prescription with you. Plan ahead for potential minor illnesses by packing some over-the-counter medications. This list offers some of the common conditions experienced by travelers, along with the medications that treat those symptoms. Buy them in sample-sized containers and keep them in their original packaging. Carry all medication prescriptions and over-the-counters with you in your carry-on bag. Know before you go. Food. For many people, trying the local cuisine is a big part of the travel experience, but take some care in what you put in your mouth to prevent foodborne illnesses. Avoid uncooked or undercooked meats, fish, produce, eggs, and dairy products. Even cooked foods should be avoided if they've been left standing out for more than 2 hours. Look for the word pasteurized on any milk or cheese product you consume. You'll also want to be aware that you're eating on your flights. If the airline food is obtained from a country that has food precautions, it's best to skip it and bring your own snacks on board. Water. You've probably heard it countless times. Drink lots of water. And you should. But when traveling, take care that you know the source of your H2O. Tap water and ice cubes are common sources of bacterial or parasite infections. It's better to choose bottled or boiled water. This even goes for brushing your teeth. Purchase drinks only in unopened, sealed bottles or cans, and wipe the cans clean before you open them. Some places will refill bottles with tap water, so make sure to check those seals. Steaming hot coffee and tea are normally good choices. Just take care not to burn your mouth. Also, be careful not to swallow water while bathing or swimming. Bugs. To prevent illness or infection from insect bites, such as mosquitoes, ticks, or fleas, use bug spray with DEET or picaridin in it. First put on sunscreen with at least SPF 15, then apply the bug spray. Use insect repellent with permethrin on your clothing, bed nets, or backpacks. Pre-treat items 1 to 2 days before you travel to be sure the treated items are dry before you packing them. If these products cause a rash or swelling, wash your skin immediately and seek medical assistance. Pay attention to peak mosquito exposure times to further protect yourself. If you go hiking, stay on well-traveled paths. Tuck your pant legs into your socks and keep your shirt tucked to help minimize exposure to bites. Use bed nets if you sleep where mosquitoes are plentiful, and make sure the nets reach the floor or are tucked in under your mattress. Sexual health. Sometimes people become less inhibited when they travel and take risks that they would not otherwise take, including making unhealthy choices regarding their sexual health. If you anticipate sexual activity or even just the possibility of it, bring condoms with you. Plan ahead so you'll be prepared. Free condoms are available at the Student Health Clinic. Regardless of your sexual preference, become familiar with what is culturally acceptable. We want you to feel comfortable being who you are, but it's important to be aware of what is culturally and legally accepted where you'll be staying to keep yourself safe. The Educated Traveler. Okay, so we know we just dumped a lot of info on you. If you've missed anything, don't worry. Hang on to the handout that lists all the details we just talked about. If you didn't get one or you lose it, a printable version is found on the Student Health website at shs.usf.edu. We look forward to seeing you at the Student Health Clinic for your travel health appointment and wish you an amazing, exciting, incredible, and healthy education abroad experience. Travel well.